Finding patient privacy, doing my hand hygiene. Hi, how are you doing today?
I'm doing really good.
My name is Kirsten. I'm a nurse here.
Okay.
And today I'm going to be doing a head-to-toe assessment on you. So what that is basically just a full checkup. Is that okay with you?
Yep, that's awesome.
All right, before we get started, I'm going to look at your wristband here. Can you tell me your name and date of birth, please?
Yep, Mary Fran Williams, October 30th, 2002.
Okay, perfect. Thank you. And Mary Fran, do you know where you're at today?
Yeah, I'm at my house.
Okay, and do you know roughly if it's the morning, afternoon, evening?
Late afternoon, early evening, I want to say. I haven't looked at my watch.
Okay, yeah, you're right. It's roughly the evening now. Okay. So now I'm going to take a look at your pupils.
Okay.
Now I'm going to be assessing them for perilla. Okay, so you're going to get a bright light in your eyes here. Perfect. Now can you please focus on that corner of the door there, and whenever I bring my pen light in, I want you to stay focused, okay? Perfect, thank you. So your pupils are equal around and react to the light and accommodation. And now I'm going to be assessing your muscle strength. So I'm going to be doing your wrists, your hands first, okay? So I'm going to try and push your fingers down, and please don't let me, okay? Perfect, thank you. Thank you. And now I'm going to be doing your arm, so I'm just going to flex, and please resist as I try and bend your arm, okay? Thank you. Now we're going to be doing your legs, so I'm going to extend one leg, and please resist as I try to bend it. Perfect, thank you. Lots of strength there. Okay, so your muscle strength is 5.
Yep.
And you could feel everything there. It's no problem. Sensations are good, and you have no tremors that I'm noticing. And you are orientated, you're listening to my verbal commands, and your eyes are opening spontaneously.
Okay.
Now I'm going to do your pulse oximetry, your oxygen saturation, and it should be above 95.
Okay.
And are you experiencing a cough, Mary Fran, that I
No.
should be aware of?
Nope.
Okay, so you don't have any sputum then?
Nope.
And you're not on any oxygen, are you?
No, I'm not. No.
Okay. And just by looking at your breathing effort, it is relaxed and regular. I'm not seeing any signs of distress.
Okay.
And now I'm just going to take a look at your breathing rate and your rhythm. Okay, and both are within normal limits there. And now I'm just going to take a listen to your breath sounds, okay? So I'm going to do some spots in your anterior chest, and I just want you to take a deep breath in, please. Thank you. Deep breath in, please. Another deep breath in, please. One more. Thank you. Now I'm going to do your lateral chest, please. Okay. Deep breath in and out. In and out again, please. Thank you. On the other side here. In and out. In and out. And you're still feeling okay? You're not dizzy?
No.
Okay. And deep breath in and out. In and out. Okay, perfect. Thank you. So everything was normal there, okay? I didn't hear any abnormal breath sounds. Your breathing sounds were clear in all lobes. Okay. I'm going to be doing some assessments for the cardiovascular system, so for your heart, okay?
Okay.
And I'm going to just be feeling your arms for temperature with the back of my hand and your legs, and it's even temperature throughout, warm and dry. And now I'm just going to be taking a look at your fingernails, okay? I have to assess you for capillary refill. Perfect, and those are less than 2 seconds each. And now I'd like you to just lay down, please. We're going to take a listen to a part of your heart. I'm going to listen to your apical pulse, okay?
Okay.
Okay, so you can get back up there, thank you. And your pulse was a regular rhythm. It was within normal limits of 60 to 100 beats per minute. And now I'm going to be assessing some pulses on you, okay? And whenever I do this, I'm assessing for rhythm, rate, and amplitude. So I'm doing your radial pulses, okay? Now I'm going to do your dorsalis pedis pulse, okay, on one foot, and then I'm going to do the other foot because I'm always comparing bilaterally. And now I'm going to do your posterior tibial pulse, and then I'm also going to do it on the other side of your foot, on your other foot. And I would also do your femoral pulses. I would get you to lay down for that because it's in your groin area. But today you're not in the gown, so I'm not going to get you to do that, okay? And your pulses were all regular. And I'm also going to assess you for some pitting edema. And you have none of that, so that is great. I also want to test your skin turgor, so I'm just going to pull up your skin, let it down, okay? And that went down within 3 seconds, so that's within normal limits. That signifies to me that you were properly hydrated. Now I have some questions to ask you about your urination, okay? Yep. So I see that you're not needing a catheter, so that's great. And whenever you're urinating, Mary Fran, are you having any burning, urgencies?
Nope.
Okay, what about some back pain and pelvic pain?
Nope.
Okay, and are you confident you're not losing control of your bladder?
I am very confident, yeah.
Okay, perfect. And what would you say the color of your urine is?
Very clear, pale yellow. I drink a lot of water.
Okay, so that would be the cause of that. That indicates to me that you have proper hydration, which is what we want. And since you're telling me that your urine is a pale yellow and that it's nice and clear, is it cloudy?
No, very clear.
Always clear. Okay, that's exactly what we want. And for your urine amount each hour, roughly, would you say that has changed any?
It's definitely more than the average person, just on account of the amount of water I drink, but it's nothing abnormal.
Okay, so normal urine amounts is 30 ml to 2 tablespoons an hour.
It's probably like 45, 50.
Okay, that's great. That's what I want to hear. Okay, so now I'm going to be asking you some questions in regards to your gastrointestinal system. And I would first begin this assessment by taking a tongue depressor and putting it on your tongue, looking inside your mouth with my pen light, getting you to say ah, and inspecting your oral mucosa, and I would expect that to be intact and moist.
Okay.
And before I take a look at your abdomen and listen to your bowel sounds, I'd just like to ask you some questions, if that's okay.
Yep, sure.
Okay, so have your bowel movements been regular?
Yes.
Okay, and when was your last one?
This morning, actually.
Okay, and would you say that you're continent? Your bowel, you have control of your bowels?
Yeah.
Okay, perfect. Are you experiencing any nausea or vomiting?
No.
Okay, and what about your nutrition lately? Have you been eating the same? It's normal?
Yeah, I've been, pretty normal. Everything is within,
Okay, perfect. And now what I'm going to get you to do is I'm just going to get you to lay down, please, onto your back. And we're going to take a look at your abdomen.
Yep.
And I'm going to just look at different angles here with my pen light as well. I'm looking for an aortic pulse because in slimmer people sometimes you can see it, but I'm not seeing it in you today. And I'm looking for any abnormalities, and I'm not seeing any masses, distension, bulges, any hernias, any vascularities, nothing alarming. Your umbilicus is central, and your skin is smooth and intact. Okay, and do you have any pain in your stomach today, Mary Fran, before I get started?
No, I don't. No.
Okay, so I'm going to take my stethoscope, and I'm going to listen to the 4 different quadrants for your bowel sounds, okay?
Okay.
Okay, so whenever I was listening there, I didn't hear anything abnormal. Your bowel sounds are all within normal limits. I heard about 5 to 30 in each quadrant, which is normal. And I also heard them for about 5 to 15 seconds each. Okay, so you still have no pain. Okay, now what I want to do is I want to palpate each quadrant, okay? Just going to take my fingers and do some light circular motions, feeling for any masses, fluid, distensions. Everything so far seems to be smooth, intact, nothing abnormal. Okay, and you can go ahead and put your shirt back down there, and you can sit up, okay? Alright, so now I'm just going to do my skin integrity assessment, okay?
Yep.
So upon viewing your skin, you have pink skin. It's within normal limits for your ethnicity, and your skin is intact. And I'm not seeing any signs of infection or inflammation. There's no redness. And I'm just going to make sure that your skin is nice and warm bilaterally, and it is, so it's not any hotter on one side or anything like that. And I don't see any ecchymosis or contusions. And do you have any wounds that I need to know about? I don't see any on you right now.
No.
No? Okay. Are you experiencing any pain today?
Nope.
You're feeling good?
Feeling great.
Well, that's great to hear. I'm going to do a neurovascular assessment on you.
Okay.
So upon viewing you, you have a normal skin color for your race. It's pink. And I'm just going to feel for your temperature with the dorsal aspect of my hand and your arms. I'm noticing that it's nice and warm. I'm going to do your legs. Your other one. And it is warm bilaterally again. So now what I'm going to do is I have a paper clip here in my hand, and I'm going to get you to close your eyes, and I'm going to touch some parts of your body with it, and I would like you to point to me where you are feeling these sensations, please, okay?
Yep.
Okay, and where is that?
My forehead.
Okay, perfect.
And my bicep.
Yep.
My quadrant.
Mm-hmm.
My thumb.
Yep.
And my foot.
Yes, that's right. Perfect. Thank you. So you have normal movement and normal sensation there, and I'm not noticing any swelling whenever I was assessing that. And if you were to have a cast on, I would assess above the cast and below the cast for any hot spots, drainage. I would make sure that it is intact, and I would also look for any edema and make sure that the temperature is warm as it should be. So upon completing my head-to-toe assessment, I would notify the physician of all abnormal findings, and I would use the nursing process to analyze subjective and objective findings. I would use it to create a nursing diagnosis, a plan, and then I would evaluate that plan and revise it as needed. Thank you.